Hello, you're watching Vibrant Living, where we bring the medical experts into your living room to help unlock the secret to the fountain of youth, to help you feel better, look younger, and have a more vibrant life. My guest today is Dr. Brian Smith from Palmetto Dental Arts in Bluffton, South Carolina, where he is using cutting-edge techniques and technology to restore smiles through dental implants. We sent our camera crew to Bluffton, South Carolina to catch up with Dr. Smith and his team. Take a look.
I'm Dr. Brian Smith. I'm the founding dentist at Palmetto Dental Arts here in Bluffton, South Carolina. I was born in Estill, South Carolina, which is about 45 miles inland. It's a small agricultural community. Not a whole lot to do there, so I was coming to Bluffton and Hilton Head starting at a very young age in the summertime. So I married my wife Amy about 20 years ago. We actually met in Bluffton on the May River. Together we have 4 kids, 3 girls and a boy. Lainey, Isabel, Harrison, and Brinkley. We do a lot of outside activities. We spend a lot of time in the water, in the river. We have kids that love to tube and ski and wakeboard, and we have a great time with friends and family around the water, very water oriented. So the very first day when we set Palmetto Dental up, I wrote a vision for Palmetto Dental. And that vision statement has been the one thing that's held constant through the years. It is to pursue excellence in every aspect of patient care. And that's whether they're on the phone, whether we meet them in the waiting room, or whether we're in the back doing significant dentistry or sedation or implants or anything more complex. It's always to pursue excellence. The mission of Palmetto Dental has always been to change lives. It's actually to change your life story. And I think we do change people's life story every day. And we're pretty passionate about that.
Please join me in welcoming to the Vibrant Living studio, Dr. Brian Smith. Dr. Smith, thanks for being here.
Colin, thank you so much for having me. I'm excited that you're working to get this information out there. So many of the people we see just are surprised by what we can do today, and they wish that they would have known earlier.
Now, you're local, born and raised nearby the Bluffton area, is that right?
Yes, I grew up in the low country of South Carolina, spent a lot of time in Bluffton and Hilton Head, as well as Savannah, Beaufort, that kind of the whole area.
Now, what you do, you couldn't do without an amazing team of people supporting you. Tell me about the team that you've built to be able to provide this service for your patients.
Oh, the team is instrumental in what we do today. It's funny, the way we started, it was just my wife and me in this practice, and my wife no longer works inside the practice, she still works with the practice. But we've been very, very particular in bringing in team members, and we've grown the team. And really we have a team of special people that are very good at certain parts of patient care and exactly what they need at the time, and kind of figuring out what that is and what the patient's desires are. And so these people, each one plays a very key role in what we can do in the practice today.
Now, for those who don't know you or your practice, what is your practice about? What are the procedures that you offer?
Well, it's interesting. After dental school, I did a residency, and in that residency, it was really focused on implants and cosmetic dentistry and being able to restore someone's bite. And so over the time, since we started the practice in Bluffton, that's really what we focused on. And it's grown, things have changed, and the one thing that stayed constant is we've focused on those things. The vision of our practice is to pursue excellence, and we do that we attempt to do that in every single interaction we have with each other and with patients. And so we're constantly striving to pursue the excellence.
Now, I know you're in Bluffton and you see patients around that area, but people are coming from all over the place to get this service done. Talk to me about that.
It's pretty amazing, and one of the things that is unique about what we do is we do it all under one roof. We have a board-certified periodontist on staff. We can do all of the surgical procedures in our office. I do the restorative side of the implant, so we can finish what we start. And then we also have the imaging in our office. We have the cone beam where we can do all of the latest and greatest imaging in the office. So we really have taken a very complex situation and made it very simple and made it streamlined.
Now, I know that your office is a general practice, so you guys do everything from A to Z, but you have created this practice built around these patients. Talk to me about your typical patient and what is their concern?
The vast majority of the patients that come into us come for one of a couple of reasons. A lot of times it's function. A lot of times people will come in and say, I just can't eat anymore. I'm eating things that are horrible for me. I'm eating starches. I can't eat meat, or I can't eat protein. I can't eat a salad anymore. And so it's that functional aspect. And a lot of times people will come for that. I would say many times people come because of aesthetics. They're concerned about the way it looks. I had a lady that was in the office the other day, and she came in. She had had dentures for a long time. She came in and said, I want to do something about my dentures. And usually I'll ask, well, we can do something, I'm sure, but what spurred this? And it was her granddaughter. And her granddaughter had said, Grandma, what's wrong with your teeth? And she said, well, she thought she had something caught in her, the denture or something. So she kind of looked in the mirror and she said, well, nothing's wrong with them. And her granddaughter said, well, they're moving when you bite. Your teeth are moving up and down. And that really spurred her to do something. She said, I know if my granddaughter noticed it, a lot of other people have noticed it, they've just never said it. And children, of course, are brutally honest.
Sure.
And so we were able to get her into fixed implant prosthesis that just changed everything. She is so excited. She said that she had no idea that she could do it. She didn't know it was even an option.
So if dental implants like you mentioned, to take a loose denture and to fix it now to a new set of fixed teeth, if that's such a great option, how did she not know about it?
We see it all the time. And what happens a lot of times when someone has a denture, the only reason they would go to a dentist would be if something breaks, or maybe to get it relined or something like that. So they're not seeing dentists regularly. And honestly, a lot of dentists aren't talking about implants once someone gets into a denture, because it can be a little bit more of it is a lot more complex at that point. But if it's someone that does it all the time and is doing it successfully and predictably, it's not that big a deal.
If you're just joining me, I'm here with Dr. Brian Smith from Palmetto Dental Arts, based in Bluffton, South Carolina, one of the nation's experts in placing dental implants and restoring confidence and restoring hopelessness with people who are in a loose denture. Talking about that same subject, this image, this is something that a lot of your patients, this is their reality. Walk me through, what is the typical day of someone that's in a loose denture?
So if you're not familiar with this, it really does completely change someone's life when they go from having teeth to having something removable like a denture or a partial. And there are a lot of people out there that are headed that direction or are there. And so, if someone gets up in the morning and this is their reality, their teeth are sitting in a cup on the side of the bed, I hear stories all the time about getting up 20 or 30 minutes before their spouse because they don't want their spouse to see them without their teeth.
Is that right?
And it's not just the teeth, but it's the facial form, because once the teeth are gone, the bone begins to shrink away and the face kind of sinks in, and they don't want their spouse to see them that way. And so I hear every day, my spouse doesn't know I have dentures. And they may have been married for 20 or 30 years. And that's, is that a reality? In their mind it is. I don't know if it is or not, but we see it every day. And so you go from getting up early and putting the goop in the teeth and trying to get them to stay in place to eating. The next thing is breakfast, right? And so breakfast for them, for a denture wearer, is oftentimes very different than breakfast for someone that's not a denture wearer.
How so?
They're eating soft foods. They're finding things that doesn't pull the denture out. So a lot of times it's starchy, carbs, things that are easy to eat. You're not eating your proteins or your fruits or your vegetables.
And that's just because because of the fact they are loose, you can't.
Well, they're loose and they don't want the embarrassment of something moving or shifting or falling. And then, so you've got that at breakfast, but then you've got all the social things. We live in a very active community. I mean, we have retirees that they don't come here to wait in line for heaven, as some people say. I mean, they're active and they're out there moving around and doing things with other people. And I've heard over and over again how when someone went to a denture, it changed their social situation completely. They quit going to the brunches or the lunches or the meetings or the whatever it is they enjoyed. A lot of times choirs, singing, all of this stuff changed.
You restore smiles through dental implants. Let's talk about this option and why is it so much better for people in a denture?
Someone can come in this type scenario where they are putting their teeth in the jar the night before. So they wake up in the morning, go through the procedure we talked about of putting the teeth in, come into the office, and that day they leave with teeth that are fixed, that do not come in and out. And it changes their lives immediately. It is an incredible procedure.
Very good. If you're just joining me, I'm here with Dr. Brian Smith from Palmetto Dental Arts, and now you sent us dozens and dozens of case photos, before and afters of patients, people that came to see you that had severe dental despair. And I want to go through a few of those with you here. This is one of the first ones you sent us. Tell me about this patient and what was their concern when they came to see you?
This is a very interesting case. This is an attorney. And so he had gone to the dentist regularly for a long, long time and had kids and a busy practice, and things just started to happen. And so one of the things that fell kind of by the wayside was his dental care. And as it progressed, it got to the point where he was really embarrassed about the way it had become. This guy's in great shape and lives a very active lifestyle, but for sure the teeth didn't match the man. And so he came in, and there was some anxiety there at this point, and some embarrassment for sure, and just said, what are my options? My daughter's getting married, and I'm going to be in the wedding, and I can't go looking like this. I can't even smile in the pictures. I'm going to be in all these pictures, and he showed me how he smiled, and he didn't smile. There were no teeth.
Do people, when they're embarrassed of their teeth, do they kind of adapt to that by,
For
covering
sure,
their
they cover
teeth?
their mouth and his lips. You really did not know this man had any teeth when he smiled, because he was very careful to cover them with his lips. And so he said, "What can we do? I've got a wedding coming up soon that I'm going to have these pictures taken in, and I can't go like this." And so we kind of figured out which way he wanted to go. Really figured out what his goals were. And it's interesting, he started one way. He thought that he wanted some implants and then something that came in and out. But about midway through, he said, I don't want something that comes in and out. I want to go with something that stays in. And so that's what he did, and it really did. He looks like a different person.
But we have it right here, and wow, quite the transformation.
When he comes in, the ladies that work at my office, they've commented several times on just how his personality's changed. He's smiling, he's happy, and we never saw that at the beginning. And he showed us the wedding pictures with his daughter. It was just he and his daughter, and just beautiful pictures, beautiful girl, and him smiling with this big smile, big radiant smile. He was so excited. He said, I really can't put a value on this.
And this was something like we've been talking about. With just a few implants, putting in a fixed set of new teeth. You said this is something that doesn't come in and out.
No, those are there to stay. I mean, we could take them out in the dental office, but he doesn't take them out. And it's as close as you can get to having natural teeth. He said it's really better than he ever remembered his natural teeth. So.
Well, it looks amazing, and I know we don't see the full face here, but you can imagine just the transformation, not just psychologically and emotionally, but functionally as well.
Oh yeah, he eats anything he wants to eat. So here, of course, what could he eat? It was very limited, and he's a health nut. So he was eating smoothies and things like that. He said he never ate. He actually enjoys meat, but he never would order it and never eat it. And now to this, and he can eat whatever. He can eat corn on the cob, apples, anything he wants to eat.
Anything he wants with this.
Anything. Steak.
That's amazing. I want to go through this next one. Tell me about this patient and what was her concern when she came to see you.
Oh, she's such a great lady. We love her. She came in and the same situation. She was a lot of anxiety about the dentist. And she had been going to a dentist. She had actually been going to a dentist every 6 months. And what was happening, you can see up there's actually a partial on the top that comes in and out. And what was happening is she would have a tooth break or a tooth get infected, and it was being pulled and added to the partial. I think she had 4 teeth left on the top. And this partial that came in and out, and she did not like it, didn't like the way it looked, didn't like the way it functioned, didn't really like anything about it. But the option that had been discussed with her was going to a full denture. And she really didn't like the idea of going to a full denture. She already didn't like what she had, and she didn't feel like she was going to like a full denture on the top. Her bottom teeth, as you can see, were very, very worn and just looked, she didn't like the way they looked, didn't like it at all. And so we talked to her a long time, really trying to figure out exactly what it was she wanted and what would be best for her. And we ended up settling on the top, going to a fully supported, implant-supported prosthesis. And then on the bottom, really repairing the teeth that she had and putting a couple implants in the back so she could have some molars. And so we kept her teeth on the bottom.
I want to see this transformation here.
But this is where we ended up. And
wow.
It was an incredible transformation. Same thing, just she has a radiant personality anyway and loves to smile, but now she really loves to smile. And she really had to retrain herself to smile,
Is
to
that
smile
so?
big and get to the point where she was showing the teeth. And it's just incredible, the difference in where she was and where she is.
Well, I mean, you go the before and after photo. Something about the smile and getting those teeth to look young and beautiful again takes years and years off what you look like.
It really does. Her before she started and the after is just an incredible transformation as far as the aging. And a lot of times people say this to me, I see it all the time, they say my teeth just look too old. And she loves to go to the gym, loves to work out, she stays in great shape, but her teeth just didn't match her.
Her personality.
That's
Yeah.
right.
I don't know if you get this question, but do people ever come in and wondering if they're too old for a procedure like this? Is there an age limit with dental implants?
Yeah, Colin, it's funny you asked that. I had a patient, I guess it was right at the end of last year, and he came in, he was 92 years old. He had lost a couple of molars, and he said, Brian, I can't chew anymore. He said, well, can I get some of those implants? I said, well, probably. I said, let's look into it. And so we started doing a little bit of just kind of making sure that everything would work from a medical standpoint. And our surgeon said that he didn't see any problem at all doing a couple of implants for him. And so he said, I remember him saying this when we were finished. He said, you know, I'm 92 years old. There aren't a whole lot of things that I get a lot of pleasure out of, but I enjoy eating. And I want to be able to eat a steak if I want to eat a steak, and I couldn't do it before, and now I can. He said, now I'm not limited on what I can eat. So to answer your question, no, we do implants on, we've done it the huge age range. There's really no contraindications with age.
Dr. Smith makes you feel so comfortable. He really does. He's just so low-keyed, and I had the utmost confidence in him. They just make you feel so comfortable. They're always so smiley, and they treat you as an individual. I knew that I was going to be in good hands. There wasn't any doubt about it. I had no doubt, and voila.
This guy is a great guy, great personality, very vibrant, and he deals with he owns his own business, deals with very high-end clientele. And everything about him looks that way, and he can talk to anybody. But he came in and said, you know, Brian, I'm hiding my smile. And I talk to these people all the time, and my smile doesn't match what I'm saying. He said, what can we do? And so we kind of went through a lot of different scenarios, and he said, you know, I remember him saying this very, very distinctly. He said, I'm not wearing braces. He said, don't talk to me about braces. He said, I want to fix my smile, but braces are out. And he said, and I don't have time. He said, I've looked into the Invisalign, and he said, we can do a little bit of alignment, but I'm not wearing Invisalign either. So, you know, that's what we were starting with. And I said, well, we can get you a lot better than where you are today, and we can change some things. And so with porcelain, with the porcelain veneers and porcelain crowns, we were really able to take what he had and completely change his smile. And he is ecstatic about this. He said it's changed when he's sitting there talking to a client. It's completely changed his confidence level when he's talking. And so the one thing he said to me is, he said, Brian, you should have told me to do this 10 years ago. And I did tell him, but he just wasn't ready. But he said he really wished that he would have done it 10 years ago.
Is that a reoccurring regret that you hear from patients?
For sure, if we were going to talk about regrets with either the implants or the more aesthetic procedures, the thing that I hear the vast majority of the time is, wow, that wasn't as bad as I thought it was going to be, and I wish I would have done it sooner. And with sedation, most people come in and they're not thinking about sedation. So they're thinking they're going to be white knuckling it through the procedure or whatever. I mean, there's all kinds of things in the past that have happened that they believe is going to happen again. Mm-hmm. And with sedation, I mean, this guy came in and he woke up, he said, you know, I don't remember anything.
Is that right?
I don't remember anything. And he walked out with these beautiful temporaries and came back and got the permanent ones and just had a phenomenal result.
Amazing. So if fear has been something that's holding people back, With the sedation, there's really no reason to have any of that fear ever again.
No, and we say that a lot. My team and we talk about a lot. Don't let anxiety keep you from having dental health and having the smile that you want, because we can control the anxiety with sedation.
If you're just joining me, I'm here with Dr. Brian Smith, one of the leading experts on restoring smiles through dental implants. Now I want to take you through this next patient here. Tell me about this gal and what was her concern when she came to see you.
She's awesome. She's a great patient. We love her, and we see her quite regularly. But she came in, and it was one of those deals where she said, my teeth are worn, and they are. You can see that the front teeth, she has what we call a reverse smile, where it's kind of going the wrong direction on the top. And she said, I don't like the way they look. And she's very active in the community. She's out and about all the time. She said, I would really like to explore some options on changing that. And so we kind of explored that further as far as what she wanted and what she wanted it to be in the end. And that's really what matters, is what she wants at the end, because we want to make sure we get there, wherever there is.
Sure.
And so we went through and really discussed where she wanted to be. And we actually did we call them mock-ups, where we kind of figured out, showed her some pictures of what we could get her. And she picked the picture. She said, well, this is what I want.
Kind of like a test drive almost,
That's right.
Oh,
but it's just on photos, and with digital, we have the technology that's pretty amazing, because they can see what it would look like when we were finished.
Amazing.
And so we show her where we could be with a simulation, and we showed her several of them, and she said, well, that's where I want to be. That's exactly what I want. And so we worked off of that, and it was amazing. We used some porcelain veneers and
Let's see the transformation.
crowns, and this is
Wow.
where we ended up. And it really did just completely change the way she felt.
Tell me what you did for this patient here.
We did some porcelain, and you can see the porcelain veneers on the top and the bottom. And we worked through that. This was very early on. I think this might have been the day we cemented them, or a day after.
Is that right?
So things they've actually gotten a lot better as far as her tissue. Her tissue's a little inflamed there, but it turned out just beautiful. She ended up with a great result, and she's extraordinarily happy. We see her all the time, and she's smiling and laughing, and she's very appreciative, and we're very appreciative of her.
All right, now the last one we have time for. Tell me about this patient.
This was a interesting guy. Been going to the dentist every 6 months forever, and actually took good care of his teeth, and really had quite a bit of dental work, and had done what the dentist had recommended. And came into my office and had lost a tooth or two in the back, and he was concerned about that and just wanted to know what his options were as far as regaining some of the chewing capacity that he had lost. And so in conversation, we were just talking, and he said, Brian, I don't like the way it looks either. He said, is there anything we could do? He said, I got some old crowns, and they're not looking the way that I would like for them to look. Is there anything we could do? And as we talked further, there were actually quite a few things he felt like he didn't like. He just didn't say that at first.
Sure.
He came in because his main concern was the back teeth and being able to chew a little better. But as we talked more, we found out that there was more to it than just that. And so we kind of figured out some different options for him, and he chose what he thought would be best for him, and we worked through it. And this is, again, a combination. We have a couple of implants and also the
And here's the
veneers
after.
and porcelains, and this is
another
him after.
amazing transformation.
Yeah, it was a crazy change for him, and
Wow.
we love Tim's a great guy. We love him a lot. We still see him all the time, of course, for cleanings and that kind of thing. Not for dental work. He's finished with that.
Sure.
But he says all the time, I wish that I would have gotten to you earlier.
Another regret of putting it off and putting
It's just
it off.
if I could have gotten to you earlier, it would have been a lot. That's his only regret, really. But it turned out great, and he has a great smile, and also he can eat again, he can chew. That's really what he came for.
Sure.
But he also gets the benefit of having just a great looking smile.
Such another remarkable transformation. Now, our camera crew had a chance to sit down with Tim in your office to hear his story firsthand. You've got to see this.
I had chipped teeth in the front from youthful accidents. I had 2 sets of crowns in my upper front teeth. They did not look natural. They stuck out. And over the years, I got into the habit of avoiding smiling when I could. I knew it wasn't right, but I never knew how to fix it. Dr. Smith's staff told me, described to me what could be done, and I was just fascinated. The gum disease disappeared within 6 months. Looking back, it was the best money I've ever spent. It solved health issues, appearance issues, future health issues, all the risks that we face as we age. So it just was a good thing to do.
What an amazing story. And this is something that you and your team get to do all the time.
It is. These are the patients that we see day in and day out. People come, obviously we see a lot of people in the surrounding areas, Savannah, Beaufort, Hilton Head and Bluffton for sure, but people actually travel in. I mean, Hilton Head's a destination, and we have people that are flying in because we can do it all under one roof. And people can come here, get their things done, we can work around their time frame, and they're finished. So it is, it's something that I feel very blessed to be able to do day in and day out because it's what I love.
Now, if there was a final message that you want to share with that community there about these procedures, what would that be? It's don't let anxiety stop you. If you're in a position where you've just hesitated to make this phone call, it's been so difficult, or maybe you're embarrassed about where it is, don't let those things keep you from being healthy and from having the smile that you desire, because we take care of that. We can handle that with sedation. And the other thing, I mean, if you're out there and you've decided, well, hey, I've got to make a change, and you've been told that maybe you're not a candidate, we do consults all the time at no cost. No
Zero
cost. So if they want to find out their options, they can sit down for free, ask questions, and see if this would be a good option.
Yeah, and just see if we're a good fit. You know, make sure that what we're talking about and what they want are aligned. But we do it all the time, and we do it for free. We do it consults for implants, for veneers, cosmetic dentistry. We do all of that for free, sedation dentistry. So if somebody has a question, we're happy to answer it.
So there should be no reason at all for anyone to at least come see you and figure out if this would be a better option than, like we said, the loose denture or a smile that they're embarrassed about.
We would love to see them. We're pretty passionate about what we do. We have assembled a team. It's incredible and really second to none. Be able to do everything under one roof and really streamline the process. We'll take a really complex process and make it simple.
Amazing. That's all the time we have for today. It's been very educational. I mean, we have way more photos that we could cover, and I feel like we could go on for hours and hours. But I want to thank my guest, Dr. Brian Smith, for joining us today on Vibrant Living. If you're in Bluffton or the surrounding areas and something said today has struck a chord and you're ready to make a change, I want to personally invite you to reach out to Palmetto Dental Arts, Dr. Brian Smith and his team. Dr. Smith, thanks for coming on the show.
Colin, thank you so much.